And welcome to the Flint Community Webinar Coronavirus. This is August 19th. We're in week 127, bringing to you information about this global pandemic and other issues in our community. This webinar is brought to you today by the Flint, by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Prevention Research Center. I'm excited today to be your host, Yvonne Lewis, the co-director of the Healthy Flint Research Coordinating Center's Community Core, as well as the Director of Outreach for the Genesee Health Plan and other activities in the community. We're just so excited that you're here to be with us today for this webinar. We've had over the last 127 week, a number of community partners who've joined us every week to be a part of this webinar, and we want to appreciate you for being a part of the webinar. We've had some of you share with us in outreach and community, just to let our community know that we are working together to make sure that we provide information that you can use. We trust that this information has been credible. You've trusted the information and you're utilizing it as you see our community partners working together out in community. Today, we are acknowledging that this is National Immunization Month, Awareness Month, the month of August. And for those of you that know, we're looking to get immunized. We talk about it over the years, be wise, immunize, but we're also unaware that there are a number of questions. And today we're going to be looking to answer some of those questions that you might have with respect, particularly what's going on with the coronavirus and some of the questions that you have. Today, we have an exciting lineup for you. We have our Dr. Hackert is here with us, Dr. Susan Wolford, Dr. Jennifer Edwards Johnson, and we do have a special guest today, Dr. Mohammed Sati, who is going to share with us on one of our topics, global public health, why it's important to you. I know we're looking at this as a local context, but we're also talking about why this information from a global perspective is relevant to us at a local level. And we're going to talk a little bit about, again, a special moment today, digging a little bit deeper into some misinformation, answering some questions that have been brought forward by community members, and looking at other news from the health department as well as the city of Flint. So we welcome you today, and initially today, we're going to have Dr. Heatherlyn Uphold is going to introduce our special guest for today. Dr. Uphold.
I'd love to. Thanks, Yvonne. So Dr. Sati is an assistant professor at Michigan State University here in Flint, where he teaches for both the public health and global studies programs. So his work focuses on not only public health, but parasitology, immunology, and then infectious diseases. Like Yvonne said, he's here to talk to us about, to give us a taste of global public health and why it's important. And we're excited to have him. Make sure that you get your questions in the Q&A, and we'll do our very best to answer them. Dr. Sati.
Thank you very much. I'm very happy to be part of this great effort, community outreach. And I hope to be able to communicate some of the information about global public health. The next slide, please. So let's start with explaining what is global public health. It is considered as a health of global population. And recently, we have seen rising attention, of course, focused towards training, emphasis on health problems and their solutions in low, middle income countries, because we always say we are not safe until everyone is safe. And recently, CDC has established a Center for Global Health in 2010. And the reason for that was to address some of the global problems, global public health problems, and coordinate the efforts in solving them. So domestic and global health are indivisible, and that there's no country can protect, no country can protect the health of its citizen in isolation from the rest of the world. Can I have the next slide, please? So, global public health area for study, research, and practice, and it places priority on improving health and achieving health health equity for all people worldwide. And these efforts require a lot of coordination globally. There is a need to work towards reducing inequalities and to fight preventable diseases. And there is a need for making health care accessible and affordable worldwide. As we said before, this is part of the policy of we are not safe until everybody else is safe. Now, next slide. So what do we mean by global burden of disease? Because if we want to solve the global health problems, we will have first to study the problems. And one way to know about that is to study the global burden of diseases. It is a comprehensive regional and global study of diseases. And this is done through assessing number of factors, including mortality, the rate of death, morbidity, the severity of the disease, disability among the population, the financial cost of the illness, and the risk factors that lead to these situations. Can only be done through global collaboration. These studies is not done within single countries. It has to be coordinated and shared between all the countries. And it is very important for proper planning and for health decision making. We'll have first to know the magnitude of the situation before we can design our health policies. Next slide. So this is the normal stage of human life and what the intervention can do. This is based on the quality adjusted life years, which is a measure of the quality and quantity of life. So normally with the age, if we don't intervene properly, the quality of the life will be declining. But with the proper diagnosis for the problems that we may have and for the proper intervention at the right time, we can prolong the life quantity and quality. So that is the increase the age and make people live longer, but also, enjoying a better quality of life. The next slide. So if we want to determine the global burden of disease, we have to start with knowing what are these diseases. There are two types of main, the non-communicable diseases and communicable diseases. So what is the difference? The non-communicable, these are not transmissible directly from one person to another. They are also known sometimes as chronic diseases, and they take long duration. And there are some risk factors that lead to these diseases. Some of these factors are related to genetic factors. Some are physiological, environmental, or behavioral. But most of these factors are modifiable and avoidable. Next. So that is the non-communicable disease. What is the communicable diseases? These are the infectious diseases which are transmissible from one person to another. Everyone knows about the COVID situation. So either through direct contact from an infected individual or other means like discharges. There are some other indirect contact, indirect transmission through vectors. We all hear about the Lyme disease, for example, in the US, transmitted through ticks. And there are some other ones which are transmitted from the animals to the human, and we call those zoonotic infections. Next slide. So in order to intervene properly and plan properly, we will have to study and know the different determinants of health and in different regions. And this include the employment situation, the work condition, the income, the education. social support that the communities are getting access to health services in different areas, gender discrimination, the biology and the genetics within the population, and the behavior. We have to study the behavior of the population, healthy behaviors, and social environment and physical environment. All these are areas of intervention that can lead to better, can lead in reducing the risk or the exposure to the diseases. Next slide. So we know that there are a lot of global disparities that in the burden of non-communicable diseases, and these, they will have impact on the communities. So socio-economic inequalities are the major ones, and we have the disadvantaged population. We mean by disadvantaged population, you will find at all in all countries, whether it is low or middle or high income countries, some populations are at higher risk of social exclusion, violence, poverty, and also there is an evidence of association between socioeconomic inequalities and the burden of the non-communicable diseases and their risk factors. So intervening and studying this is important. So disparities in behavioral, and this is the behavior, and dietary is one of the risk factors for non-communicable disease. Why I choose this to talk about is because it's modifiable easily, and we need to educate the populations and the communities about it. So what are the risk factors within and under this risk, under behavioral and dietary risk factors? For example, smoking, alcohol consumption, overweight, obesity, diet and nutrition, physical activity, these are all linked, and they can be risk factor for non-communicable diseases. These are different in the different countries. So the significance of these different risk factors differ between the low-income countries, middle-income countries, and high-income countries. The next slide. What is so example of these non-communicable disease? What is the most important ones? We have the 5 most important non-communicable diseases: the cardiovascular, cancer, chronic respiratory disease, diabetes, mental illnesses, and also we have some others which are less important, but they are also there, less prevalent, like the autoimmune diseases, Alzheimer and Parkinson's. Next slide, please. So global public health challenges. Aging population, we are striving to improve the quality and longevity of the life. So we are having more aging population, and this requires more public health services. Also, when we talk about global public health, we need to pay attention to the diverse population, and that requires culturally sensitive communication. So different cultures needs to be approached differently. And we need to have more focus on health policy. And by health policy here, we talk about laws, we talk about regulations, actions, decisions, all directed towards promoting wellness and towards ensure that specific health goals are met. Next slide. So the WHO program, WHO, World Health Organization, they have a plan for improving availability and affordability of essential medicine and basic health technologies for non-communicable disease worldwide. And that is by achieving 80% availability of affordable basic technologies and essential medicine to treat major non-communicable disease in both public and private facilities. And this is of specific special importance to low-income countries and middle-income countries. Also, they have a plan to define ways and means to assist member states in their national efforts to improve equitable access through a set of actions. This also here puts some burden on the high income countries to do their share. Next slide. So that was the end of that talk.
Thank you so much, Dr. Sate. I know that there's some real interest in some of the things that we talked about in terms of global health. And so we understand that global health does impact us locally. And one of the things that we wanted to be sure that just for a quick moment, you can talk about, I know you teach this class, you can talk about how you make the connection between what's happening globally and then locally. And we'll move to our next segment.
So for example, we take the COVID example. For example, whatever we do inside the US to vaccinating people, and this is a huge effort, but without coordinating with the outside world and with the era of globalization and the ease of movement between the countries and the open borders, and we can still, one person can bring this the infection again back to. So that's why we say it is important to coordinate, and it's also important to look at what is going on beyond our borders here. And that's investment in our local protection also.
Thank you. So looking at investment locally, and when we talk about this webinar, we're talking about bringing a local context to the global pandemic. So we're aware that there is a global impact. So we want to thank you for that background, giving us just a good insight on the different types of issues that we are addressing. And so we want to move to our next segment, which will be with Dr. Wolfert, digging a little bit deeper. When we talk about the issues, as we've heard globally, and we hear from all over the different parts of the country about what's happening particularly as it relates to COVID, because that's been the focus of this conversation. We've asked Dr. Wolfert to have a quick conversation with one of her doctor friends about misinformation and disinformation and why that is so important.
Thank you so much, Yvonne. Thank you for this opportunity to, as you say, dig a little deeper into this topic of misinformation and disinformation. And you might ask yourself, well, what's the difference between those two? So let's imagine that maybe you are allergic to nuts, or maybe you can't tolerate dairy, and you're hungry and you come to me and I have this lovely banana bread. And you say, can I have a slice? And I say, sure. You say, well, you know what? I'm allergic to nuts, or I can't really tolerate lactose or milk. And I say to you, well, to the best of my knowledge, neither of those things are in here. Now, as it happens, there are nuts and milk in it, but I don't know that. What I know about it is that it seems like it just has bananas and flour. So I tell you that, you eat it, you're still going to get gas, right? But I didn't mean to hurt you. I just didn't know, and I told you what I knew. And unfortunately, it had a negative outcome. Disinformation is if I made this banana bread, I know I've put milk in here, I know I've put nuts in here, and I know that you're allergic to nuts or you are lactose intolerant, and I give it to you and I say, oh no, it doesn't have any of those things in there. The intent is to cause you to have a very uncomfortable afternoon. So with that in mind, as we think about the misinformation and disinformation that's out there, the fact that in either case, it can really have poor outcomes for us as we use that information to help us make choices, I would like to dig into that topic a bit more as we discuss this with Dr. EJ. And we're going to look at some of the questions that have come in from our viewers and from the community about the different myths that are out there. So, Dr. EJ, thank you for being here. We want to ask a little bit, starting off with the issue of natural immunity versus vaccine immunity, right? So many people will say natural immunity is better and better than vaccine immunity, and so therefore we don't need to get the vaccine. What would you say to them about that?
I think the premise that you started with is really helpful, right? I think we've been told that we have our immune systems and they're meant to protect us. And so, you know, our best intention is understanding, well, our immune systems are intended to protect us. That should be enough to keep me safe. But we've done lots of great studies on this that show that when you get infected with COVID, sometimes you have varying levels of immunity, and that getting vaccinated is really superior to what we've seen with the natural immunity data. And it protects you before you get COVID. It ensures that your risk of death or hospitalization is significantly lower. And it does that before you sort of necessarily have to get natural immunity, right? So natural immunity is something that happens after you've gotten COVID, and it is something that would happen by your body responding to COVID. But sometimes that can be incomplete, and it's helped by our vaccines. And it also means that when you do see COVID, if you encounter COVID, that you've already gotten some protection from the vaccine. The vaccine has done that for you.
Thank you so much. That is so important. That idea that, yes, we absolutely have to get our immune system in tip-top condition, but there's still benefits of getting the vaccine. So it's not that you do one and not the other, that you actually really need to do both, right?
Yes, absolutely.
So then many people will say, well, now we're coming up with all these new treatments and there are very many options. And so for that reason, we don't need the vaccine. What can you share with us about the treatments that are out there and whether or not we need the vaccine in light of those treatments being available?
Yes, we're so excited about the opportunity to have new treatments for COVID. The ones that come to mind that you guys might have heard of are, right, those monoclonal antibodies for people who are in the hospital and might have severe COVID. And Paxlovid has been something that people have heard a lot about and has been really helpful. There are two things that we think about, right? We're again thinking about those end outcomes that we want to prevent if possible, right? We want to prevent hospitalization and death if at all possible. And one of the things that Dr. Reynolds likes to say a lot is multiple layers of protection and multiple layers of opportunities to keep us healthy, right? And so the vaccine is one of those layers that hopefully can either prevent you from getting COVID or prevent you from getting severely sick, hospitalized, or have a really bad outcome from COVID. The nice things, we do have some treatments available. They're not available to everyone, right? They haven't been approved in all populations. Pediatric populations still don't have, you know, a really great treatment for COVID. And there are some contraindications to some of those medications. So people on certain medications may or may not be able to take, you know, Paxlovid, or monoclonal antibodies are pretty exclusive to people who, you know, have some pre-existing health conditions. So not everyone can necessarily avail themselves to the treatments that are out there. They're not approved for necessarily everyone. And I think the biggest piece is, again, prevention where we're able.
Absolutely. That's so, as you say, it's wonderful that we have other options, but we need all of the layers, all of the layers. So what about people who, okay, maybe they want to get the vaccine, but they're afraid of getting it for many reasons. One of the things we hear a lot about is how the vaccine, people are concerned. They've heard that it affects periods, it affects menstruation. And so then they think, oh my goodness, this is going to affect my fertility, my ability to have children. And if I am pregnant, it will affect that. What do we know about the vaccine and fertility and pregnancy?
This is a great question because I'm a parent myself. So I completely understand that worry, right, of parents who are worried that long-term effects on fertility, or that they're with child and that the vaccine might pose a risk. What we know is it actually confers protection, particularly for people who are pregnant, right? So we know that getting vaccinated while pregnant confers protection to the newborn when they're born, right? We also know that it provides antibody levels that are protective for the person who's pregnant, and it really reduces their risk. Whenever we think about treatments, or whenever we think about something that we're going to give to pregnant people, we're always thinking about risk versus benefit. And the risk that we're considering in people who are pregnant is the risk of getting COVID while pregnant, right? And that risk and the severity of that risk is so high, and the risks associated with vaccines are so low that it just makes a lot of sense to get vaccinated and make sure that the unborn child gets that protection and that the person who's pregnant gets that protection as well. The other piece I'll say is at this point, we've gotten so much really good data on vaccines. We're almost 3 years into these, we're almost 2 years into these studies, and we've been able to look at larger studies and do larger studies, and we're still seeing very low risks associated with the vaccine.
Wonderful. I remember Dr. Deborah once saying on this very webinar that what a gift to give your baby, right? To get vaccinated so that you can give the gift of greater protection rather than having them be at risk. So
and
yeah.
It's really exciting because now we have pediatric vaccines. And so you're getting closer to sort of bridging that gap of protecting your kid until 6 months when then they can receive the series of vaccines.
Absolutely. Well, thank you so much, Dr. EJ, for helping us dig into this topic. We have a few more questions, but before we run to those questions, we're going to bring some others into the conversation. I believe Dr. Hackett is going to join us. I'm not sure if any of the other panelists will be able to, but we're going to bring Dr. Hackett and and Dr. Reynolds into the conversation at this point. We want to get everyone's perspective here on this really important issue of the misinformation and disinformation that's out there. So anything that either Dr. Hackett or Dr. Reynolds would like to add at this point before I roll into the next question?
I'll follow Dr. Hackett.
I did send to Heatherland. I can't seem to post to everyone. I'm not sure if that's a new change that's deliberate, but it's a recent ProPublica article, and this is the very catching title: God, no, not another case. COVID-related stillbirths didn't have to happen. And it talks about how, why these pregnancy or fertility issues really weren't addressed early on. And that just opened the space for a lot of disinformation.
Absolutely, absolutely. And now with the new variants, there's even more disinformation and misinformation to be shared about that. So I know that people are saying, okay, we have these new variants, so the vaccines don't work, and so it's no point getting them. Dr. Reynolds, what would you say to somebody who said that?
Well, the vaccines can prime your immune system, so you will get a response sometimes quicker than no protection at all. And that's important. It's like it just triggers your antibody response. It will stimulate your cellular response. So it's important. It's, once again, it's another layer of protection.
That's right. That's right. And
I like to liken it to a seatbelt, right? You know, you wear your seatbelt when you get in your car, not because you're expecting to get in an accident and, you know, you're not upset that your seatbelt didn't sort of prevent the accident. The goal of the seatbelt is to prevent you from getting harmed should you get into an accident, right? I would think of the vaccines the same way, right? The vaccines are intended to prevent you from being hospitalized or prevent you from having a really severe outcome should you end up with COVID, right? Just like that seatbelt prevents you from, you know, a severe outcome. That's what the vaccine is meant to do. We would love if seatbelts like prevented car accidents, and we would love to not get COVID. But what we have is the layers of protection, like Dr. Reynolds said.
I love that seatbelt analogy.
I do. I'm sorry.
No, yes, Dr. Hackett.
I was just saying, I love the seatbelt analogy, and I think I had shared that I had COVID about 2 months ago. I had a fairly moderately severe case of it, and I have the fully 4 vaccines. And so rather than, I know enough about the science behind the vaccines. So rather than saying, oh, they didn't work, I thought, oh my gosh, good thing I had the vaccines, because I would have had a very severe outcome, perhaps even dying. And we know that COVID death is like a very awful, prolonged drowning death. And it is not a good death at all. So it's one that's very scary. And so for me, having that, I was the opposite. And I think that's true though about seatbelts. It's like when we say seatbelts are to protect us, you know, and hopefully we don't get injured, we know that there are a lot of very severe auto accidents with seatbelts. However, when you look at the comparison between no seatbelts and wearing a seatbelt, then the risk of any kind of injury goes down tremendously. The risk of having, you know, I'll be graphic, having your head go through the windshield goes down dramatically. So all of those things, it doesn't prevent the bad outcomes, but it really mitigates it, really takes it down. So for me to have a pretty moderately severe case of COVID when I was fully vaccinated, my thought was, oh my gosh, how bad would I have been without these vaccines?
Absolutely, absolutely. The misinformation that's out there that is stopping people from getting this form of protection is so very concerning. I'm going to bring Dr. Gordon in at this moment. Apparently, she has been aware of some of the misinformation that's out there. Don't go away, team. We'll see how we can respond to Dr. Gordon and the misinformation that she's hearing out in the community.
Hello, everyone. Good afternoon. Some of the misinformation that we're hearing is like, especially like in the church sector, is like it's the mark of the beast. Also, that it has a microchip, that it gives you COVID. It causes HIV. It's just some of the things that we're hearing in the community, or that, you know, that is still in your DNA. It's going to alter your DNA. So we call ourselves the COVID mythbusters while we're out there and kind of dispel some of those myths. Just like Dr. Hackett and myself, I also had COVID and I had it twice. I just had it in April and had a pretty good case of it, and thank God I was vaccinated, because I thought to myself as well, if I had not been vaccinated, would I end up in the hospital or, you know, death? Because it was pretty something to tussle with. So I encourage people, you know, I don't force the vaccine, but just from my own personal experience, it does, you know, do what it's supposed to do, help your immune system fight off COVID. But those are some of the misinformation that, you know, I've heard out while we're out in the community, especially like, you know, that the microchip that's altering your DNA, also that's causing infertility in females. There, you know, were some studies about the menstrual cycle changes. So, and those are some of the concerns that I've been hearing out in the community.
Wow, Dr. Gordon, thank you so much for bringing those out. Nurse T, I'm going to ask you to join us as well. There's certainly a lot of disinformation that people are having to handle. Nurse T, you've been hearing some of the same things out there, or what have you been hearing?
Yes, I've been hearing some of the same things. And one of the unfortunate things that I've been hearing from some of the Black and brown community is that they thought that the vaccination was a trick, that it was something used to harm them, you know, put them back into slavery, you know. So instead of being utilized as a help, they thought it was a way to bring us down. So just busting up those myths and trying to reassure the community that it was intended to be safe and not to intentionally harm them. And some of the times when they were having signs and symptoms from receiving the vaccination, they would say, see, I told you this was just another source, you know, to harm or hold down the Black and brown community. But just being a united front and making sure we're continuing to educate and help them understand, you know, the natural intent or the organic intent of why they created the vaccination is not to harm, but to help.
Absolutely. Thank you so much, Nurse T. That is really what seems to come out from all of those different examples of this misinformation and disinformation is that we have sometimes a smidgen of truth, sometimes none at all, but sometimes a smidgen of truth mixed in with a lot of error. And so, for example, the menstrual differences, there are menstrual differences that has been seen, it has been documented, but there's no evidence that it affects fertility. And so it's really, and yes, it's true that there have been things in the past in our health system and our healthcare and in our society that have been actively against people of color, but the vaccines that were being given for COVID are not part of that. So, disentangling any smidgen of truth from the error is so important. What do you, Dr. Reynolds, any advice about what we should do or what we can say in this setting?
Well, the first thing I say is I'm vaccinated myself, and I do it not just for myself, I do it for my family, my community, and you've heard me say many times before, my 93-year-old mother, who is with age, who will be more vulnerable. It's also for my grandchildren, who at the time were not eligible for vaccination. So it's not just something we're doing for ourselves. It's for the people we care about. Quite frankly, it's for the people we don't care about. But we're all in this together. If I may digress, we have a problem of people assigning geographic locations to diseases, like calling COVID-19 the Wuhan virus. And I apologize, I have to repeat that ignorance, but nonetheless, I will. Because then it causes other people to discriminate against those who are from that area or from that nation. And we have to be very careful because, as I said about vaccination, we're all in this together. Pandemic doesn't mean it's selective. The virus doesn't care who you are, where you're from, what you do, what your income is. So you will notice that the WHO is starting to assign a different type of name to the viruses.
Absolutely. Thank you so much for bringing that in. Well, I think our time is running out. I'm going to give Dr. Hackett the last word on this misinformation and disinformation. But I want to thank Dr. EJ for helping us dig deeper into this topic, Dr. Reynolds, Dr. Gordon, and Nurse T, and Dr. Hackett, final words on what we can say.
My final word is that this disinformation is really hard sometimes to separate. I have seen people at all levels of health knowledge, including doctors. We see that all the time. And so your concerns, if you have them, are valid. There are plenty of people, though, with a great deal of experience who would be happy to discuss it, and discuss it not in a condescending way, to really discuss it and come up with, what are your concerns, and let me show you what, I can tell you, like studies, I can tell you, just personal anecdotes, like we can address your concerns. And so please bring them up to us. And that doesn't mean you have to then get a vaccine the moment you bring it up. You can get a vaccine, you can come discuss the concerns and then think about whether or not you want to receive the vaccine.
Wonderful. Thank you so much. There's so much information to be shared. There's so much disinformation and misinformation out there. We will revisit this topic at upcoming webinars. Thank you, everyone. And I'm going to hand back over to Yvonne.
Thank you so much, Dr. Wolford. We appreciate you facilitating that segment for us, because it's really, really important that we understand the questions, because the whole focus of this is the education. And one of the main things that we want to do is understand what the questions are so we can educate about them. We're not looking to try to make anybody do anything, but accept, have good information so they can make an informed decision for themselves and for their family. So again, thank you, Dr. Wolford. And that last comment from Dr. Hacker in terms of education, we do want to take this opportunity to appreciate and recognize that our health department did receive special recognition for the work that they have done. So I'm going to ask Dr. Hacker to come back and share with us about these three recognitions that our Genesee County Health Department, in terms of providing education and information to our community, has received. Dr. Hacker.
So I'm not really aware of which ones. Okay, so here and there. Yeah. The Michigan Premier Public Health Conference Directors Awards, they were given out because of the response, and it's not just the health department's response, so it was the whole community's response. So that is why it's the Director's Award for the whole community, all the information that we've had, all the volunteers we've had. So that that was received in July. And then the NACHO one, that one is was a Bronze Innovation Practice Award. They only give out about 30 total, both in bronze, silver, and gold of these. And this was really a tribute to the community partnerships that embraced me personally so lovingly, really, when I got here, because I needed the support of for so many different ways. But it was the partnerships that had been established during the Flint water crisis that really allowed me to come in totally raw in January of last year and get those COVID vaccines going, finding the places to do it. And also though, how to prioritize when we had 80,000 people wanting the vaccines and we were getting 1,000 a week. How to prioritize those at highest risk of COVID. So that was a national award that we were happy to accept in Atlanta last month. And then the Voices for Children's Parents Champion Award was on the mask initiative, and then also making sure that all the children who wanted vaccines were able to get them, and there was no restrictions, or really there wasn't even lines that would serve as access barriers for those. That's it.
Thank you so much, Dr. Hackett. And we just want to, again, appreciate the work that you've done over these few months. As you said, you came in, hit the ground running, and continue to make sure that our community has access to resources. And so we appreciate that. And also all of those of our partners that have worked with you to make sure that access is available. That was churches, our communities, our schools, so many partners, all of those that have even participated in this webinar on a weekly basis. We certainly want to say thank you, because it takes a great commitment for 127 weeks as we've done it so far, Health Department, but all of the other partners who have joined in this, we certainly want to recognize and appreciate you on today. And so thank you so much. And in addition to that, we do want to just remind our listeners, for those, we talk about this every week, that there are still opportunities for vaccinations and for testing. And
I just want to add, thank you. I mean, you were one of the people that I was referring to. So thank you personally, and thank you for all the work that you do with this community outreach. It's been invaluable.
Thank you. So Ashley's going to give us a quick update on any new activities that are happening as it relates to, thank you, Dr. Hacker, so much, new activities that relate to opportunities for vaccination and further education.
Good afternoon. Yes, so we still have our 3 standing clinics at our faith-based locations. This includes Central Church of the Nazarene, Our Lady of Guadalupe, as well as Shiloh Missionary Baptist Church. Those vaccine clinics are on a rolling schedule, so they alternate weeks. So every other week we have 2 going, and then the opposite week we have Central Church of the Nazarene going. So at this time, those are going to be our consistent rolling clinics that does accommodate both adults and children. And we do have both Moderna and Pfizer available. So if you bring in your littles, we are happy to help you. We're happy to vaccinate and answer any questions that you have, any education that you might need, pretty much anything at all. We're absolutely here for you to make sure that you feel safe and comfortable protecting our little ones. Additionally, we do have pop-up clinics coming up once those locations are confirmed. Typically, those are partnered with Michigan United. Those will be posted on our website, gchd.us. Once again, the location is confirmed, please be mindful of any age parameters that are listed with that clinic. So some of those clinics may be 12 and older. If you have anybody under the age of 12, definitely don't go to those ones. We still have our HANU sites available for testing. HANU is the corporation that MDHHS has partnered with. They do have 3 brick and mortar locations, Word of Life Church, Bethel United Methodist Church, and Macedonia Baptist Church. Those testing sites include both saliva testing as well as nasopharyngeal swabs. So if you have a specific test in mind that you want to have done, please request so when you get there. No insurance or ID is needed. Appointments are not necessary. you're welcome to walk into those clinics on whatever day or time that one is open. We do have other testing and vaccination sites. This does include our Walgreens, Hamilton Community Health Network, and our Rite Aid locations. If you have any questions or concerns before you visit those locations, I do recommend you call ahead and make sure that they can accommodate you in any way or shape that you need. If you do have any additional questions, you want some more education, you just want to see all the different opportunities for vaccination or testing, again, you can visit our website at gchd.us. If for some reason you have barriers to access the website or the internet, you're always welcome to call our COVID-19 call center. Our phone number is 810-344-4800. We ask that you please leave that line open for those that have barriers to accessing our website. If you can navigate our website easily and you can get your questions answered in that form, we ask that you please do that first. We do have information available in English and Spanish. If for some reason you have any barriers at all, please give us a call at 810-344-4800.
Thank you so much, Ashley. And we have a question for you. And
Sure.
One of those questions is, what can we do when we've used up our free allotment of the COVID test?
So I do know at this time that they are readily available, and at our grocery stores and whatnot, but that may not always be a possibility for those. They can get costly at times. We do have resources. I believe it's the Hamilton Community Health Center where you can call ahead and request those tests. I do know that USPS is still offering free COVID testing, last I checked, or kits, I should say, and you can request more. Again, that is an internet-based request. Most typically, if for some reason you need access to home test kits and you can't access the internet, or you just don't seem to be having any luck, by all means, you are welcome to call our COVID call center and your call will be directed towards me.
Thank you, Ashley. Now there's one other question, and we may need to call someone else in to help with this question, and that's okay. That's why we have all these experts here today. And that is, can the COVID test tell the difference between flu, colds, or COVID?
I am going to phone a friend on that one.
I see Dr. Hackett and Dr. Reynolds.
Yeah, I'll defer to Dr. Reynolds if you want. Go ahead.
Okay. Number one, the symptoms can be similar. So if you have symptoms and you think it's the flu, go get a test for flu. It's a different test. If your test is negative, test for COVID. And now the recommendation is, and then 48 hours late from the first test, test again. And you may have to test one more time just to be sure that you don't have one of the variants or a slower immune response to COVID. So yes, I think you heard me say 3 tests over the course of 3 to 5 days.
Mm-hmm. Because we're getting into flu season, and I don't know, Dr. Hackett, if you had something to add to that. We are getting into flu season, and there are going to be some activities coming up. So I'm going to just ask Jim Melanowski too to come just for a quick minute and give an update on that before we go to our next segment. Dr. Hackett.
I was just going to say, there is talk of a test that will test for both COVID and flu, much like there are these respiratory tests that you may go into the emergency room and they do a upper respiratory panel where they can do it, but we don't have access to that kind of testing yet. It would be 2 separate tests at this time.
Okay. And so, Jim, something's coming up that you, when we're talking about the flu and COVID, something's coming up being sponsored by the health plan that you might want to update us on?
Absolutely. So a few weeks from now on Friday, September 9th is our annual flu drive-through event. Not only will we have flu shots, so those like Dr. Reynolds that are chomping at the bit to get those early, he can come and get it done through our drive-through. Very simple. We're also going to have COVID vaccines, boosters. It's a very oriented to our partners, so there'll be all kinds of folks there. You know, so it's going to be a great event, and in the future weeks we'll get out a flyer and show that to the group here, and but we would love to have you put that on your calendar and get ready for that. It's a very simple, no barrier. You just drive up and roll down your sleeve and get your flu vaccine or your COVID vaccines.
Thank you, Jim. And I do see that there's been also an opportunity that's coming up tomorrow at James Morehouse pop-up on Harrison Street right here in the city from 12 to 3. Thank you, Tarnisa, for sharing that information. Now, as we've talked about the vaccine, we've talked about Omicron, people making various decisions. We're also having an update on what the data looks like. And so we're going to ask Alan Harris if he give us an update now on what our data says.
Sure thing. Yeah, thanks for having me. As predicted, we're looking at an increase overall. I know that dip in the latest week, sort of we want that to maintain, but because of lag cases and the way that test dates come about, probably next week you'll probably see that week 128 bumped up a little bit. So as we predicted, cases are slowly going to increase, and as cases in the South are still kind of there's still a lot happening, Kentucky and Southeast US. That's going to start creeping up as everyone comes back to school, summer is over, people are indoors a lot more. That'll be the trend that we'll see for the next coming weeks.
Thank you, Alan. So that looks like going back to that original conversation about the global impact. We know that things are happening outside of our community that could impact us within our community. So we would just want to pay attention to what's going on and how we're embracing and engaging around others across the communities and across the country. Dr. Hackert, we'll ask you just to come back quickly. You made a comment in the chat that I think would be important for us all to hear.
So I know that people are calling it, I can't even say it, flurona, with the talking about getting both the flu and COVID at the same time. And so I thought, well, what is it right now? So about 4 people who have COVID, who are diagnosed with COVID, have the flu, and that's over the last 2 years. So it's pretty rare to get both at the same time. But if you are exposed to both at the same time, you actually can get both at the same time.
Okay. So while we're right here, and I know we talked about these varying precautions, and one of those is continuing to wear the mask. What's the status on that? I know things are changing, Dr. Hackert. We see so much difference, and we're getting so much different information. So what's the recommendations for our community?
So we are expecting the surge that has been forecasted. We are starting to see other communities. We've gone to moderate, I believe, and that was a few days ago, so I could be totally wrong. But it had been low when other tri-county areas were high. We had been staying low, so that was great. But I knew we had slipped into moderate, at least towards the end of last week. But we expect it to go back up. That is what's happening. And now I just saw this week that there's been a pretty good study came out, said that up to half seems high to me, but up to half of people with Omicron don't know that they have it. So they are spreading it, because if they don't know they're having it and they're not wearing their mask, they are spreading it. Absolutely. And so I do advise people to put their mask on when you are in somewhere crowded. If you have your own, and that's if you're a healthy individual, a young, healthy individual. If you have anybody who you see who's immunocompromised or vulnerable, you definitely want to wear your mask more to protect all of the, them, and then they should be wearing it. So if you are someone who is over age 60, if you are someone who has any other significant medical issues, then definitely start wearing your mask again. It is now time to do that. But there is no requirement, so it's going to be now up on the individuals. But the CDC relaxing the guidelines about that, really, they say it was in response to what people were actually doing, not what people should be doing.
Thank you. And I know just as a matter of course, we've had a couple of commercials that have run talking about wearing masks. It was supported by NNICE to just encourage our community just to be mindful and be thoughtful. So we're hoping that this encourages us just to make sure that we're doing the best that we can to keep our community healthy, and listen to the credible voices, listen to those who are just sharing information. We will all make our own decisions, but hopefully we will make decisions based upon the good information that's being shared. Even though it changes, we're still going to be listening to learn more as we move forward. So thank you so much, Dr. Hacker, for that update. We also want to just hear quickly from the city of Flint. We have a quick update from Faith.
Hi, everyone. I just wanted to share a couple of things today. The first one has to do with the water main break. There was a water boil advisory that was averted by quick action, and I want to just share some information about that. And then also some resources. There were 1,200 notices that went out this week for water shutoffs. I want people to know that there are resources available and we're prepared to help people with that. They can call us here at 810-410-2020. So I just want to share that information.
Thank you so much. Thank you, Faith, for that update. We're going to ask Dr. Wolford to come back. And again, let me just take one more quick opportunity to thank Nurse T and Yashika and so many other community members who helped us to share information with the community over the last few weeks about the webinar and making sure that we're mindful and being careful as we move about in our community. So another opportunity that we have, Dr. Wolford.
Thank you so much, Yvonne. Thank you for the opportunity to share a little bit about our symposium that is coming up on the 30th of September. By now, you have it on your calendar, and hopefully it's on the calendar of all of your network. So that we want you to make sure that you tell everyone in the community, your academic partners, that this is the place to be. And when I say this, I mean the Riverfront Center in Flint will be the place to be on September 30th, when we have our next HFRCC Research Symposium. As you know, also, the registration site has been opened, and many of you have already gone on and registered. Please go on and do that if you can. We will be ordering our, as we say, swag soon, and we want to know how much to get. So please go on and register so that we know you will be there. Also, on the website, there is the opportunity to nominate people for awards. Now, I think we're going to be keeping that open maybe for another week or so that we do have to, there's a deadline. I just can't remember exactly when it is, but I think it's going to be open for another week or two. And within that time frame, please think about the people that you would like to recognize who've made a difference for the health of Flint residents. And thank you, Heatherlyn, for sharing here what those awards are. We have the Early Career Award for a community member and an Early Career Award for an academic faculty member. We have a Community Academic Partnership Award for a partnership that's made a significant difference for the health in Flint. And then a Champion Award, both for the community and for academics. These Champion Awards are for people who have made significant contributions to health in Flint over many years. And so please, we need to hear from you. Go online. The link, I believe, has been put into the chat, or you can go to our website and the link is there also. But we want to hear from you because, again, we do everything in partnership. Our goal for this symposium is to be able to help motivate more important research in Flint, to inspire novel and new ideas, and to foster interconnection between academics, community, industry, all those interested in improving health for those who live in Flint and beyond. Thank you again, Yvonne, for allowing us to spend some time shining a light on this important event, which will come faster than we will realize in the next few weeks, September 30th, HFRCC Symposium.
Thank you so much, Dr. Wolford. And again, thank each and every one of you that joined us today. All of those of you who have spent this your hour with us on Friday for this 126 weeks and from various forms, we appreciate you. Could not do this work without you. And we want to encourage our community health workers and social workers to apply for those continuing education units and contact hours as you have been, so that you can get credit for your activities and your time with the webinar on today. And we're going to ask you to look forward to our next webinar as long as we are able to provide quality information for you. Subscribe to our Healthy Flint YouTube channel, join us on Facebook, and of course you can email us at info@hfrcc.org. We want to certainly appreciate you for joining us today and look forward to you being with us here again next week. Thank you.